focus. Again, not limiting. We cannot have one focus. What seems to be emerging is that we may be in a position, because of this breadth of how we are approaching any concept, depth and breadth, right? That we actually may be in a position, kind of unique position, to again have that emerge within the concepts as a very natural sequel to this kind of a thinking. And it will then be more rich, it will be informed by variety and maybe sometimes contradictory. Again, a lot of the contradictions on a surface that become very interconnected underneath. Yeah, sure.
Yeah, I was just going to say that, you know, in terms of, I mean, it's the application of analytic theory to technique is very important, but it's only one application. Like I think it's important to see that, I mean, I think maybe to state the obvious, that psychoanalytic theory is not the same as its application technically, and also the evidential aspects are not just about technical interventions. Like we think about regression, let's say, the evidential aspects in relation to regression as part of normal development that Anna Freud talks about, or in adolescence. A lot of those are observational. Some of them might be therapeutic, but I mean, then you apply, or what Freud described as a formal regression in dreams. I mean, there you had again evidential aspects looking at the way the dreams, followed from the manifest follow from the latent, and he, had a series of arguments about that. So that's formal regression or regression in trauma, breakdown of ego functions. So the evidential aspects, I don't think we should reduce, and I'm not saying anybody necessarily said that, but reduce evidential aspects to therapeutic interventional aspects, because then you have this broader theory, and then how it's used, as in any science, I think you have a very broad theory, and sometimes you don't know, like some of the ideas about regression, I don't think Freud knew, or that they could be useful in treating, let's say, personality disorders, which weren't even described in his day. So I think we have to, I'm not saying they're separate, but I really think and I think the Encyclopedia product is keeping that open, like the more scientific, broader aspect, right? But,
yes, and you have actually done in your work on trauma, I believe that you've done a lot.
Yeah, on that sort of aspects. Like I think sometimes experience distant can have a negative meaning in present-day analytic theory, but it's an important part of every scientific theory. As long as you have the eventual inferential steps, from the experience distant to the eventual experience, obviously, even though the steps may be very many, right?
Yeah, and you know what? Sometimes it is a matter of wording. Because the scientific thinking, right, the behavioral change, the operationalization, those are scientific sort of like natural science type of statistically relevant terminologies. And in some ways, when we work with an individual and when there is a, let's say, unconscious to unconscious connection, of course we are not going to be thinking surface now what is going on, how to operationalize it. But again, it is not divorced from it. It is not broken away from it. And that is important to see that there are a variety of dimensions, and this is one very important one.
It goes back to the organic experience of this material coming out. On another hand, from what you're saying, what we can look at in this regard is something that's very deeply needed, and that is a moving towards an understanding of defining the psychoanalytic process. Intervention and process. These are the things that are missing. We were in a recent meeting here in the DPE, and they were trying to develop standards.
What's the DPE?
The Department of Psychoanalytic Education, and they were saying, basically, does your institute ascribe to 3 times, 4 times, or 5 times a week? And most of the people in the room were saying it doesn't have to do with frequency, it has to do with getting a process ignited and moving. I'm thinking of Otto's work where 3 times a week is the top limit if you're in a severe borderline disorder. So it was the wrong question. The group was basically saying they knew that process was the answer, but they don't know how to define it.
Yeah.
And yet clinicians all over the world have their ideas about process, and this can be tapped.
Yeah, I believe that would be one of them, the concepts that are coming up. But even just any of those new concepts, you know, and any of the concepts that already have been actually part of the work. You have transference, you have countertransference, you have setting, psychoanalytic setting, right? Those are all elements or parts of the process. And now we are going towards the more technical issues, maybe, say, free association, regression, which happens and is deepening through that, and what happens with particular categories of patients during that, for instance. And that will be, and then building psychic structure. So you have a regression on one hand, and then you have building psychic structure. How do they interact? This is a very important dimension, and it is not to be approached in any kind of simplistic way. And that is, I think, that where psychoanalysis then can enrich even the field of research, actually. Because we do have latent level, many levels, right? And intrapsychic and interpsychic or intersubjective will interact. And then how does the process start, unravel?
I'd like to ask another question, because I'm very interested in Otto's idea. Otto, you have a manual already, a very lengthy, detailed manualization, right?
Maybe
You're
wrote so many of them that you know he doesn't.
Yeah, we do.
I have a copy.
I mean, yeah.
I don't use it. I don't refer to it.
I want to make sure it's yours.
Yeah, well, also, there is a manual in Europe. There's a guy named Henrik Hamrighausen's his name, Henrik Hamrighausen, who was working in Switzerland, where they have their own manual, as a psychoanalytic manual, about technique. So I'm thinking maybe as an appendix of some sort to what you're doing, you could have separate manuals from different countries.
Well,
from how they do it. You know, how does Otto's group do it? How does Henrik
I don't know that Swiss manual. Is it in German or French?
I believe it's in German. His name is Hamrighausen, and it came out a few years ago. I can't read it, but you would be able to read it. I can't read it. It's the European diagnostic or technical manual. I can write him and ask him to send it to you.
Yeah. Okay.
Yeah.
It's a manual on technique of psychoanalytic
I believe
technique.
it's a manual.
I don't know that.
Yeah. He's in Zurich.
All the time in Germany.
No, he's a German guy who's trained in Zurich.
Yeah.
And he wrote this manual over
And
a
what's his last name?
Hamrighausen.
Is it put together with any kind of idea of research or effectiveness or results or
I don't remember.
outcomes?
Yeah, I think it was something like that.
Because, you know, by the way, we are not exactly going against the history of psychoanalysis, because Fenichel, from rather early on, from 20s, already was doing research on the outcomes, right? It was tabulating outcomes. That's right. They got, now, the criteria were variably defined, but they did have 80%. He tracked the results, and they had 80% improvement. Now, the criteria of improvement, the process variables, if you want to talk the research language, the outcomes variables, we could have issues with that, but the idea was there. Now, Fenichel is not exactly a renegade, right? it was somewhere in the back of the mind. He did the research. It was one of the first actually research studies. It was in psychoanalysis. I had that in my dissertation, so real. And there were a number of studies that he put together, number of outcomes and compiled, and had 80%, which of course Isaac then later on completely debunked, right?
A third.
Yeah, but there was obviously the idea. This is what is important also for us. That this is not like we are now just responding to the to this unprecedented kind of scientificism or reductionism. That it was on their mind. Yeah, go ahead. Yeah, you were thinking something.
Yeah, I just commenting on the Wallerstein project, the Menninger Foundation, which in the 1950s started out looking for effectiveness of psychoanalysis and psychoanalytic psychotherapy. And one interesting finding was that to evaluate outcome in terms of psychoanalytic principles proved impossible. Our criteria were structural intrapsychic change. That's a highly respectable principle in psychoanalysis. Where it was, should ego be. We couldn't evaluate it in the patients. We had books of information, but it couldn't be. We had to go back to how do they behave in life. In other words, the outcome had to be measured in behavioral manifestations, not in intrapsychic changes that couldn't be evaluated precisely. Once we looked at the global aspects of the behavior, which then eventually came the global behavioral scale and the GAS scale that the American psychiatric adopted, there we could do it, and all the findings were based on that overall behavioral assessment. Yeah. And so now we are very much advanced in how to study outcome. Outcome is no problem. We could do research any day. The problem is to define clearly what are we doing.
How are we getting there?
What are our technical intervention? How do the intervention of psychoanalysis differ from those, say, of psychoanalytic psychotherapy or cognitive therapy? So you have to define psychoanalytic intervention very precisely. So when you observe the treatments, you can say, this was psychoanalytic technique, this was not. And that precise definition requires a manualization of psychoanalytic technique. This doesn't mean strict telling you what to do, what to say to the patient, but giving clear guidelines that are specific to what is psychoanalysis in contrast to what is not. That's what we need.
Yes, and I'm just thinking about the infant research where they basically are tracking the minute movements, even just mimicking or gestures of those interactions between, let's say, mother and baby. So we may need to sometimes go, not necessarily to be on a camera, but to be able to track in those very microscopic ways what is going on for us and what informs actually our intervention. But I also want to say something about that, talking about the research. So there's a long history. There were problems somehow gauging and maybe evaluating or sort of spelling out in some measurable measurable values, the intrapsychic changes, but we know when there are intrapsychic changes, and so then how do we know that, right? Because it is going to be coming up in the way how patients maybe form relationships, how they relate to us also, how they even think back then, how they are reconstructing or reevaluating how they were evolving or developing. And usually, as one of, talking about representation, for instance, now, next batch of concepts, usually as one of the outcomes, which is not very readily mentioned, is that there is a wider range of representational capacity. In a very kind of a general way, the patient starts talking differently. The nuances get expressed in more nuanced language, right? The black and white is not so. So there are certain, even just language, and I think certainly that French could be so well, because they are so into language that you can track it in the way how the person expresses themselves with words and the tonality of it. There you have, of course, less than tangible measure, right? How people are also, sort of how much they think, how thoughtful they are, how nuanced they are, how...
Yeah, but you can have all kinds of development in that way, and a gap between them and behavioral change. You say that behavioral change has been the only thing that people can point to about what is, I think that's very interesting. You know, if that's the only thing we can point to, then we know clinically that, you know, even as far back as the 60s or something, people like DeWalt writing about, you know, what analysts think of and value, which is precisely what you're talking about. But the difference between that and what some patients value, you know, we know that there are patients who can behaviorally, you know, really begin to enrich their lives and not be so self-destructive, then their internal worlds, much to our frustration, don't really match exactly what we imagine and value and so on. So
Yeah.
it's very,
I think
I
that
don't know, sort of very...
whole subject is just so multifaceted, because if we really approach it as analysts, then we are so aware that obviously the internal world and the external manifestation of it are connected. They are not disconnected, so that when we say behavioral change, well, that will always have some correlate somewhere in their, you could say, drive life or ego organization, superego modifications and all that. So, and then how they all interact internally. But, you know, the larger categories, and I was doing actually the research on those things years ago in Europe. So we had a category, for instance, insight. Okay? There was genetic insight. Then there was the there and now, the sort of interpersonal insight, and then the transference in the session, right here and now. Then we had behavior and attitudes, sort of that they might be connected. And that would be a large category. There would be a lot of very specific areas. And then symptoms, because obviously if the person doesn't like their symptoms, that will be subjectively bothering them. Although, let's say some characterological problems will be bothering their neighbor or their wife or their husband or their children, but will not bother them, right? Subjectively. So yes, you have all these all the variability of ways how to think about, but as a thought, as a dimension of what we are not excluding, rather that it should be limiting us, but that where we are branching more into and including that as a dimension. Because I think we are doing it anyway. We are not just sitting there with the patient, and we are making our minute clinical decisions based on that it would be somehow useful, right? That it would somehow enlarge something or grow something. The neutrality is essentially in terms of being on the side of a health, right? Our value.
The guy's name is Holger Himighofen, and with your permission, I'm going to send him an email copying you and Eva.
Oh, that would be wonderful.
Okay, and I seem to recall he had this.
Yeah.
I'm writing it.
Okay.
Sent.
You send it to
I
me
just
also?
sent it.
Okay,
Yeah, you
great.
can.
And it comes from you?
Comes from me.
Yeah, okay, so.
We'll see if it's the same email.
All right. Yeah, but the Lichtenberg and Rehbuch also from that was the German research published in New England School of Medicine on the dynamic therapies, that they actually are on par with the cognitive behavioral and humanistic and eclectic, right? That was the first actually mega study where psychoanalytically informed dynamic work was being credited as producing results.
That was Schindler,
Hmm?
the Jonathan Schindler.
And Schindler then still did more, kind of connected that with a lot of new studies coming from North American continent.
Well, and Barbara Milrod did a lot.
Mhm.
Richard Summers has a whole book about it.
All right, so, and there are certain categories again, right? Because they have to define then what is it that they are meaning by dynamic.
Can I have a couple minutes?
Of course.
One of the things about psychoanalysis, which is wonderful, right? It's a wonderful exercise. I'm trying to apply it in a forensic center. I agree with you, sir. How do you measure the change? I'm working in an institution. Inmates begin to pick up my language. I change the language continuously as much as I'm able to, and they seem to follow that.
Mm-hmm.
I do risk assessment. Always I'm asked the same question. How do you know that what you do works? I said, well, the only thing I have is what I see within the group. It is a suppressing situation. You all seem to be talking about epistemology. How do we know that what we know is that there is to know? I cannot argue and say to a judge, linguistically they are wonderful. They know about their mothers, they know about their fathers, they've learned about infantile sexuality. And always the question is the same, doctor, but are you sure that they will not assault outside? I don't. And we have all kinds of statistical measurements that are useless because they all have to do with what I see in the environment. What's missing for me is the application in forensic settings. The institute in Chicago is offering $15,000 prize for good paper on the application of psychoanalysis in the forensic setting.
Really?
I just picked it up. I would have done for the 5,000.
I'll send
the
them the
second.
book that Kathy Traynor did.
It's too late. I do
They just wrote a
it.
book about pedophiles.
Excuse me?
They'd be interested in a book about pedophiles.
Yeah, but since we talk about that, it would be good maybe to differentiate between infantile sexuality and pedophilic sexuality.
Well,
Is
that
that-
would certainly go under the infantile sexuality.
So that should include regression.
Should include.
Regression. In the regression, we should have it.
Well, it depends how then, how it develops.
If that's a new topic, I'd like to be involved.
Yes, okay,
I like it.
very good. It is a new topic,
Okay.
yes. Yes, now, you are bringing a very important piece, also aspect again of this encyclopedic work, and in connection with what we are talking about now, that Otto brought up, that especially the relevance of psychoanalysis to applied areas, right? Where can it be applied besides our office, besides the individual work? And while this lives essentially in the, I think, cultural zeitgeist, and is evolving as part of it, and then informs it back, right? There's a kind of reciprocal relation. But there are applied fields, and this was already Freud's idea, that essentially they can enrich the thinking of the analyst, and analyst can enrich the thinking of whatever the connected field, like art, anything else, culture, society, sociology. But there are, then the more we can be specific again and sort of translate what we are talking about into, you can say, either operational language or sort of a, again, language which could be then applied in variety of other fields. That would then that would be very important. And then, how do we pick that up with one individual patient? How do we pick that up in a group analytic setting? How do we then apply that, and how we document? What I actually find fascinating is that the Chicago Institute actually would put the two and two together. That psychoanalysis, because it after all does deal with sexuality somehow, right? Is maybe in a good position to come up with something, but they don't have yet.
Yeah, you know, it's interesting because it's a law firm that's actually behind that prize. And they approached the Institute in Chicago and said, we'd like to get some of your thinking about forensic work.
Like expert
and they put up the money for it.
But how is all of this related to, I mean, I understand Otto's idea of technique being essential in understanding the psychoanalytic process, but all of, you know, I'm not quite sure how, unless you want to add the whole notion of forensics as another topic, how that comes into this meeting today. So,
well, we are talking about infantile sexuality, for instance, as one of the concepts coming up, right?
Yes, but it's okay.
Well, I'd like to respond to that question, though. That question seems to me to be about the method of our project.
Mm-hmm.
And it seems useful to identify a divergent and convergent phase of the work that we're doing. And that in the divergent phase of the work, to question whether a topic is relevant is probably premature. If it's a divergent phase, if we're gathering, someone suggests, let's look at the forensic implications of psychoanalytic thought. I think that what you're saying is put that in. Let's see where we put that in. The convergent functions, like coming up with a manual for treatment or coming up with any other focused recommendations, seems to me goes later in a certain conceptual phase. I don't think that should guide the gathering or the determination of the scope of concepts, you know, the convergent intent. I think there should be a phase where, if it's proposed by someone who's working psychoanalytically, as you've said, that's reason enough to try to find a place for it within the overall scope. And then ultimately, there will be work towards what's the utility of it?
Well, that's the thing, that actually now I like the how you sort of put it on that continuum, or we could take it as two opposing categories, but rather the dialectic, the ongoing dialectic, right, with the divergence and convergence. Because yes, we are starting with also Rosemary was talking about the exploratory, right? Mm-hmm. And that's where we are cautioning against premature integration. And that is right in the philosophy. Yeah, go ahead.
But I also heard that we're trying to address problems that we don't find great success in: pedophilia, predictability of violence, social violence. And these are areas that really need to find a place because we're having such trouble with them clinically.
Yes, and that's actually a very interesting, a very important piece, because if you go to, of all places, to our entry unconscious metaphysical concept, right? There is such a thing as a group unconscious. And
Yes.
a lot of Furlong up in Montreal suggested we need group unconscious also. So we went into the category, subchapter, group unconscious. You are there, okay?
Yeah.
So, terrorism,
Yes.
we have it there.
Sanctioned social
And
violence.
now, so it was included, but let me just read it to you, look the piece, because this is actually really important. The same as mentioning the sexual deviancy with the ego. Assessment and the ego functions, all right, and then the technique. So we are embarking on this very naturally, organically. They are already starting there. But let me just go. Where is the
I
unconscious?
have it right here.
Where is the unconscious?
I have it right here.
You have that? Yeah, okay. So I just want to let you know the scope. Okay. It's huge. Yeah, okay, but that's what yeah. Group unconscious. Only if you look at, so we have unconscious in neuroscience also, by the way, but talking about the interdisciplinary group.
Right.
Okay.
Excuse me.
Okay. Thank you so much for coming. We'll be following up. Okay, so let me just quickly let you know what is there already, okay? Just headings.
Yes,
okay?
that was.
Just that you would know that these are already starting, and this is metapsychology. Okay, group analysis. So all right. So it starts with Freud, right? A lot of, by the way, 22 publications altogether. That 22 titles, and then of course just 3 most known: analysis of the ego, group psychology, analysis of ego, and then civilization in the discontent. It starts with the totem and taboo, and then we go into beyond Angier, Yatkin, Kernberg, now group analytic therapies, Milia, social violence and terrorism, Otto, historical trauma, ethnic unconscious, social international crisis. There's Volkan among others. Organizational and dynamic psychohistory. Before conclusion, that's the last chapter. So yes, that's the divergence, which is now